Good afternoon, everyone. My name is Jackie Leiser. I'm a manager with CAQH Core, and I'm excited to welcome you to this afternoon's webinar with a joint series with X12. Today, we'll be discussing healthcare claims. So we'll be talking about the 837 transaction and its corresponding operating roles. We are joined by a few wonderful speakers who I'll let introduce themselves in just a couple of slides. But before we do that, I'm going to go ahead and go over the agenda briefly. We'll jump things off with an X12 overview, and that will be followed by information about the 837 transaction. We'll talk about purpose and scope, benefits, users, and workflow. After X12 presents their slides, we'll switch gears and talk a bit about Core, providing an overview about what Core is, and then specifically diving into the Core healthcare claims operating roles. So that will include the existing infrastructure role, and we'll also provide a brief update on our upcoming rule development initiatives that have been going on in 2023. We'll wrap things up with some questions and follow it up with a brief call to action. Taking a look at our next slide, just to go over some brief logistics for the audience. If you'd like to download the presentation slides from today's presentation, you can go ahead and do so now in the handout section of your GoToWebinar menu. We'll also send out an email to all attendees and registrants in the next couple of business days, and that will give you information on how to access slides, as well as a recording of today's presentation. If you have a question at any time throughout the webinar, you can go ahead and submit those in the questions panel on your GoToWebinar menu. We'll be monitoring those questions and taking a look at them at the end of the presentation. So please feel free to submit them as they come to you. All right, so like I mentioned, we have a few great speakers with us today. I'm going to go ahead and let them introduce themselves briefly. So Bob, we can start with you and just kind of go across the screen if that works.
Great. Good afternoon. Bob Bowman. I'm the Principal of Interoperability and Standards here at CAQH Core. Been here for 15 years working on operating roles and been participating with X12 standards development for over 20 years now. So with that, I'll hand that call over to Michelle.
Good afternoon, everyone. I'm Michelle Berry. My role here is really the X12 liaison to Core. So again, that is my representation, and I've been working with our Core team for, oh goodness, probably about 7 or 8 years, specifically around Core operating rules in X12. Lynn, I'm going to turn it over to you.
Hi, I'm Lynn Chappell. I currently work for Optum. I've been employed in the healthcare industry for many, many years. Started out working at hospitals as a billing rep and then moved to a payer as a claims processor. At that time, everything was done on paper. But while I was employed at that payer, I was involved in implementing electronic transactions. And as I mentioned earlier, I now work for Optum on the X12 validation products.
Good afternoon, Jamie Mosteller. I'm with Oracle Health. I've been working in the healthcare industry for 29 years. I've been participating with X12 for the last 17, and I've been one of the co-chairs of the claims work group for the last 12 years.
And this is Stanley Nachimson. I am the principal of Nachimson Advisors, a small consulting firm. Been involved in health information technology for many years, from my time at CMS, writing the HIPAA regulations, through the present, where I assist entities in understanding federal regulatory requirements, health IT, and how best to implement them. I'm, along with Lynn and Jamie, a co-chair of the X12 work group that handles the claims transaction.
Great, thank you all so much. If we take a look at the next slide, I'm going to pass things over to Bob to give us a brief level set on healthcare claims, and then we'll kick things off with the X12 side.
Great, thanks, Jackie. And one thing I do want to maybe point out is that over the last couple of years, we've done a lot of joint sessions with X12, and many of those have been focused on either the eligibility transactions or the remittance advice, the 835 transaction. This is our first attempt at educating the industry on the 837 transactions and what they might include. But with that, we are excited because it is one of the most highly electronified, new word, right? That we hear a lot now in the industry, for being implemented, right? Many providers submit their claims via the 837 transaction, via medical or dental or institutional claims, whatever that version is that you're submitting. Many of those are submitted electronically. However, it doesn't mean that there's still not challenges with the data. And so we're looking here on this slide at the CAQH index, the most recent one, the 2022 version. And you can see that the trends are really great for the industry, right? Over 97% of the medical claims transactions are submitted electronically. And with a steady climb for dental over the last couple of years, up to 86% of the dental claims are submitted electronically. So it's still important to understand some of the challenges that the standards development organization faces in meeting current business needs as they develop the standard, and how we partner with X12 at CAQH and develop operating rules that support the electronic adoption of the transactions and ensure that the data moves from point A to B, from providers to health plans in this particular scenario for the claim, to ensure that claims can be paid expeditiously, automatically, and leads to less abrasion for the provider. So with that, I'll hand the call over to Michelle, and she can kick us off on X12. Michelle?
Great. Hopefully my sound check is a little bit better this time.
Yes, you sound much better. Thank you.
Coming in through.
Okay, just wanted to double check, triple check, and make sure. So thank you, everyone. Thanks, Bob. Just want to say thank you to this entire team for your time, dedication, and want to make sure that everybody understands we appreciate you joining today's session as well. So a couple things that I need to share with you and team before we go any further. If we could go to the next slide. We're going to talk about some information, but before we get there, want to make sure we talk about this really quick legal disclaimer. And the presentation you're going to see from an X12 perspective today is informal. Keep that in mind, and informal purposes. So with that said, we're also losing my voice again, does not represent any legal advice. So I want to make sure everybody understands that. And also the information contained within the PowerPoint and the discussion today is really point in time content. So anything is subject to change. Next slide, please. We're going to talk about X12. We're going to learn more from the subject matter experts, and we're going to drive discussion into opening it up for your questions to ask the panelists. We're going to talk about the 837 dental, institutional, professional. We're going to talk about the purpose and scope of the 837. We're going to talk about those benefits that attribute to everything that is being utilized in the industry around the 837. And I say everything is pretty much high level, but it gives you an overview of those benefits. We're going to talk about the users of the 837. Who are those entities? Who are those organizations? Clearinghouse vendors, health plans, etc. We're going to talk about the workflow. What does that look like? Last but not least, we're going to wrap up with some closing statements. Next slide, background. One more slide. We're going to talk about our organization at X12. We are really designed around consensus-based standards. So if you think about from that perspective, that is our focus. And our focus is really trying to drive the development of those standards across multiple industries, cross organizations, interoperable data interchange. So keep thinking in that time or that sense, that frame of mind, because that is who we are. That is where our focus is and where we are today and where we continue to move. Our standards have been proven reliable, efficient, effective, and supporting organizations and other entities for over 40 years. And we're going strong. We maintain electronic messaging that supports finance, government, healthcare, insurance, property and casualty, supply chain, transportation, and other industries. Next slide. Not lastly, but maybe just to really kind of complement the previous slide, we're talking about how we look at information. We have hundreds of organizations, members that participate, almost thousands of organizations and members participating and representing their organization to help establish those standards, that level of communication. And again, it spans from claims to eligibility and benefits to provider data. And if you want more information, we'll give it to you at the end of the session so you know exactly if you're interested, if you're not already a member, can come and join us. But the membership specifically talks about those organizations, those associations, those government entities and individuals that participate in creating use cases, implementation guides, B2B exchanges, so business to business exchanges, and partner to partner standard development. Next slide. This is actually a great slide when we talk about, stats and data. We talk about the implementation base of X12, and a couple of things that are super important is we have billions of transactions from across the US and its territories that utilize EDI, that utilize X12 standards. And keeping in mind with that, we also have other industries, like I stated earlier, finance, insurance, property and casualty, supply chain, transportations, logistics. It's not just healthcare. And then we also have millions of entities, again, around the world who have helped establish the infrastructure that supports X12 transactions. So think about how logistically, maybe is the right term to use, that X12 reaches spaces that maybe you didn't even realize existed. So that is some really good information to take away. You'll have access to all this data in the PowerPoint presentation. Please do not forget to download. Last but not least, our data interchange or exchange and X12 transactions are really focused on those defined level fields and the data that accompanies those fields. So think about that as well. And again, 40 years of existence, over 40 years is pretty impressive. So, some would say true and tried and really supportive transactions, because again, it's not just current support, it looks at future state. We have innovators who come to the table with really great opportunities. Lynn, Jamie, and Stanley and Bob as well, are those individuals around the 37. So again, you'll hear more from them in just a second, I promise. X12 organizational structure. Two things I want to point out here, the board of directors and the membership. So we have a board of directors. The members, of course, are the ones who drive to the other standards organizations. So we've got the ASC chair, ASC steering. We've got the focus around the other governmental handles. We've also got the RSC. And if you look at the ASC column, you'll see all of those X12 industry participating groups, organizations, entities. So again, you look at this information, this is just information for you to take a look at. Any questions you have, you can always go to x12.org to get additional information, and we've included that site in the PowerPoint presentation, so you don't have to worry about writing it down. Talking about the organization a little bit further, I'm not going to go into multiple details, but I'm going to talk about ASC real quick because we did reference in the previous slide. This is the Accredited Standards Committee. This committee is really dedicated to developing and maintaining the EDI standard and related implementation guides. So you've heard the term IGs. That is what it is. It's an actual implementation guide. So acronym SOUP as we speak these days in the healthcare and other industries. You've also heard the term technical reports. And I think that's important to bring out here too. Implementation guides and technical reports, kind of the same thing. So keep that in mind if somebody is referring to a technical report. Just, engage in the conversation and say you might be referencing the implementation guide. Am I understanding correctly? So the last but not least important is the RSC. That is the Registered Standards Committee. This particular committee really talks about the development of those external code lists. They oversee that particular external code list. That code list is super important for a multitude of reasons. You want to make sure that code list is updated, and you want to make sure it's updated timely. So again, from an RSC perspective, that is their charging orders. And keeping in mind, they also help out with the X12 terminology, vocabulary resources, and making sure that if there are changes, they work those changes through the process. Next slide. Our products and services that we offer, we do have a product library. That library does include the EDI standard, technical reports, as I stated earlier. We have type 2 and we have a type 3. Implementation guides. You will find all the implementation guides for all the X12 organizations and entities that you saw in the particular structure, organizational structure. Again, external code list, schemas. We've got pretty good list of schemas and other offerings designed to help implementers implement the implementation guides, the technical reports. Next slide. I promise we're getting close to the end, and I'm going to turn it over to Lynn, Jamie, Bob, and Stanley. Most important, our approach, we really look at open-minded, vision-driven, insight related to the healthcare industry. We look at the opportunity to take information and exchange that information, not just in the current infrastructure that we've built, but looking at the future state, looking at emerging technologies and how do we really engage. Think about APIs, right? So we have opportunities from an X12 perspective and have guides that help support not just current, but also future state technologies. Responsive, again, to current and future business requirements. We look at those use cases based on state, federal, local laws, mandates. We look at everything that the organization participants, members provide. So don't think for a minute it's one or two people. It is a plethora of individuals that have the expertise and the level to help move the information forward so that the implementation guides can be out for the industry to consume. And passionately, we collaborate and we look at things very differently. We look to see who is going to be impacted. We look to see where do we need to focus more. And we get insight. So it's not an opportunity to sit back and think. We invite you to participate and share your use cases, share your thought process. And with that said, I am going to turn it over to the next portion of the presentation for our subject matter experts on the X12 837 side. And we're including Bob from a core perspective regarding the operating rules. Thank you.
Thank you, Michelle. Jamie Stanley and I will be talking about the purpose and scope of the 837s, the benefits, the users, and the workflow. I will be covering the purpose and scope. The 837 standard and the implementation guides, which, as Michelle said, are also known as technical report types 3s. You will hear those terms used interchangeably. These have been developed to enable healthcare providers to submit claims data to health plans for reimbursement purposes and encounter data for reporting purposes. The implementation guides define rules for uniform implementation across the healthcare industries. 837 claims data could be submitted from providers directly to health plans or through transmission intermediaries such as a clearinghouse. The 837s can also be used to exchange data between payers for coordination of benefits. There are multiple versions of the 5010 837s used for different business purposes in the industry today. One of those is the 837 Professional. This is currently a HIPAA mandated transaction. This implementation of the transaction is used for professional claims and or encounters. For an example, this would be to submit charges and associated data for adjudication of claims for office visits. The 837 Institutional, which is also a HIPAA mandated transaction. This implementation is for institutional claims and or encounters. An example would be to submit charges and the associated data to adjudicate claims for facility charges for inpatient services such as room and board and ancillary charges. The 837 Dental, also a HIPAA mandated transaction, is the transaction used for dental providers to submit claims data. The predetermination functionality is supported in the 5010 837 Dental, but not in the current HIPAA mandated 837P and I. That functionality will be in a future version that will be proposed for HIPAA mandated. These three HIPAA or versions of the 837s are maintained by the X12N Workgroup 2 Claims, Encounters, and Attachment Information Workgroup. On this slide, you will also see that there are other versions of the 837 that are not HIPAA mandated. These are out of scope for a presentation today, but we just wanted to mention them. There's the 837 reporting. There's 3 837 post-adjudicated claims data reporting and the 837 predetermination. So I will now turn this over to Stanley to talk about the benefits.
Thanks, Lynn. Actually, I thought that Jamie was doing this, but was I mistaken?
Yeah, you're doing benefits, Stanley.
Great. Okay. So important to recognize that there are considerable benefits from using electronic transactions, especially using standard electronic transactions. And as we know, HIPAA requires that the industry, providers and health plans, exchange these standard electronic transactions whenever they are conducting business electronically. We have the standard claim enables its use consistently by multiple stakeholders. There is enough detail in the implementation guide to make sure that folks understand what needs to be sent, in what order, what the data content is, the structure of each of the data elements, and when they should and when they shouldn't send them. The transactions allows a provider to submit their claims directly, going to a health plan, or it also allows them to submit those claims indirectly, first through a clearinghouse or a billing service in a standard format. And those intermediaries then know the specific format to expect or create and can send it forward to the health plan. The transaction gives payers the information they need to process that claim transaction and either pay it as it's submitted, make some adjustments to it and pay only part of it, or deny the submitted claim. But the information is there for them to make that decision. Because it's in a standard electronic format, this allows the possibility of a high percentage of first pass adjudication. In other words, since basically it's automated and we know exactly what's coming in, there can be automated processing, and there is, in most cases, or in a very high percentage of cases, no need for any manual intervention to pay or deny the claim. Also allows, the implementation guide allows the submission of coordination of benefits claims. In other words, if there are more than one insurance company involved in the payment for a service, if an entity has, for example, if an individual has a Medicare and a Medicare supplemental plan, for example, two insurance companies that will be processing the claim, the transaction is set up to allow the first payer to do what they need to do to process the claim, and then they can either forward it electronically to the secondary payer if they have an agreement, or they can return it to the provider, and then the provider can send a secondary claim to that secondary health plan. So that business process is built into the implementation guide. Again, it allows for standardized data to be transmitted between trading partners. And so you know exactly what data is and isn't coming in, what the structure of that data is. And importantly, the claim transactions use the information that is gathered in some of the other business transactions. For example, the eligibility transaction will verify the health plan and coverage that an individual has with that health plan. So a provider with the information gathered from an eligibility transaction can then fill in that information on the claim and send it to the health plan. Next slide, please. Is this still me? Sorry about that. The users of the transaction are healthcare providers, such as physicians, practitioners, suppliers, facilities, hospitals, labs, any type of entity that provides medical services and needs to bill a health plan for those services. Healthcare and property and casualty workers' compensation payers, in other words, the health plans that receive those claims. Clearinghouses, vendors, repricers, and trading partners, again, those intermediaries that serve as a pathway between a provider and a health plan to get the claim to where it needs to be, and then those payers who submit COB claims to other payers directly. And Jamie, I believe you're up on the next slide.
Yes, I will pick up from here. So for the workflow, after a service is performed, a submitter, who can be an individual provider or a billing entity, will gather all the necessary information about the patient, health plan, and service or services to create that claim or encounter. An electronic transaction will be created and sent directly to the payer or to an intermediary for further transmission. There could be several intermediaries in the flow, and each of them may perform in their own edits and have the ability to accept and or reject that transaction. Upon receipt by the health plan, there are, again, additional business edits that are going to be performed to determine if they're going to accept or deny that transaction. A health plan does additional processing to adjudicate the claim and come to a final decision. Providers in some cases can get an acknowledgement. They can query the payer for a claim status and will eventually get a response in the form of a remittance advice. Next slide. So as we start to wrap up, we can move to the next slide. Just a reminder, X12N maintains a library of informational PowerPoints, position papers, checklists, and many other things. You can visit X12's Info Center at x12.org to review many other relevant documents, including ASC N023, which is an overview of the N subcommittee, which is where a lot of these transactions report up through. Document 24 is for an overview of X12N's task groups. And document 25 covers the actual work groups, which claims is work group 2. And then document 26 through 38 provide more details about each of the X12's individual work groups. Next slide. And then if you want everyone to please stay connected, you can continue to learn more about X12 and how to become a member at x12.org, as well as staying informed on social media at X12 Standards on Twitter and pound X12 on LinkedIn. Next slide. And now we're open for any kind of questions, feedback, and or ideas. Those can be submitted at x12.org/feedback. All right, I think that turns it over to Bob.
Great, yep, perfect, thanks Jamie. And what we'd like to do now as we transition into the core overview is just give you a quick update on who CORE is and why we're in this space, kind of what we do and how we do it, and then get into the nuts and bolts of the operating roles that we've developed for claims infrastructure, and those are already available for free on our website, that help supplement the conduct of the 837 transactions that Jamie, Lynn, and Stanley, and Michelle just talked about, as well as moving into what we're working on currently right now on data content related to the transactions as well. So on the next slide, you'll see that CORE is a mission and vision driven company. We are considered a industry-wide facilitator. We're a coalition of organizations that meet, talk about problems that relate to both the exchange of information and data, as well as the data itself, making sure that providers have access to the data that they need when they need it, and health plans receive data that they need to do their operations as well. So, right, that equation is really important. And we know that all of this is really supported by a huge part of the industry related to clearinghouses and vendors and people, those intermediaries that Jamie mentioned, of who works in this space. So as you can tell, as you can imagine, there's lots and lots of organizations. So we work with those groups, those types of stakeholders, to develop and support standards that help accelerate interoperability, align administrative and clinical activities amongst all of those stakeholders. Again, we do this through a really iterative process. We'll talk more about that in just a moment. On the next slide, you'll see that it's important for us to ensure that as we develop those business rules, those mechanisms and kind of statements that data has to go here and there, you need to turn these levers on in the standard to get the data to flow through, or you need to use this type of internet connectivity to ensure that everyone has access to the data, right? Those business rules really help drive adoption in using the electronic transactions and standards. We have been federally designated by HHS as the National Operating Rule Authoring Entity for the HIPAA standard administrative transactions. So if it's a HIPAA standard transaction, we'll be in that space helping the industry adopt those transactions. We don't limit ourselves to just HIPAA mandated transactions because we understand that business sometimes bleeds beyond just what's in the standard, the needs of the business, both the provider need as well as the health plan need. We work in that gray space where there's not a designated standard, but SDOs have developed standards to meet those needs. They might not be required under regulation or law, but they help support the actual needs of the business. So we'll be in that space too. We develop operating rules for those types of standards as well. You can see on the next slide that our coalition is huge, right? We work with all the different constituencies and stakeholder types within the industry. Hopefully you see your name, your organization on this list. If not, we'd love to have you participate with us to get your perspectives. It's really helpful. I think just as Michelle said, when the industry comes together to talk about the issues and challenges that they have and to remove abrasion points, it's helpful to have everyone's perspective. X12 has that when they develop their standards. CORE has that when we develop the operating rules. It really helps build a lot of synergy and workflow. We can tackle workflow challenges because we know where the data needs to go when it needs to get there. Talking about operating rules specifically on the next slide, they really are very specific things. The ACA does have a definition that they are the necessary business rules and guidelines for the electronic exchange of information that are not defined by a standard. They are federally mandated for specific transactions, and we'll talk more about that as well. Many industries use operating rules. Any kind of industry that you think of where you're exchanging data like financial services, transportation, retail, where data has to go from point A to point B, not only is that standard really important of what the data elements are they alphanumeric, how long are those fields, what can be carried in them, what are the code values if you're using a code set, all of that's defined by a standard. The operating rules help ensure that the standard levers are on and off to make sure that the flow of data goes where it needs to go. And so we create those common expectations for that electronic data exchange. Again, we're speaking specifically about healthcare in this particular case, so it's really important that we look at those use cases. On the next slide, you'll see that it's really important that no matter where you're at in the revenue cycle, there is probably a standard developed for that phase within this cycle, as well as a set of operating rules. We work really closely to make sure that, again, if there's a HIPAA standard, there's a set of operating rules to go with it, either for infrastructure or for data content, as well as those gray areas that there might not be a standard designated by HIPAA, but we are going to be there working with the SDOs as well as the industry to define the best operating rules for those interactions as well. Moving more directly into the specifics of the healthcare claims operating rules, on the next slide is our introduction slide for this, but we're going to go directly into our infrastructure requirements on the next slide. Now, we do have very specific infrastructure requirements that have been published and designated by the core participating organizations. These are the infrastructure requirements for the 837. So this is really just ensures that a network, a system can be established within the US to exchange this data in a very uniform, consistent way. There's no surprises. It allows for direct connect, or you can connect through intermediaries. It's really the provider's choice. The provider can use whatever system they want, whatever practice management system, whatever vendor, whatever clearinghouse, whatever EHR that they wish to use, and work with that vendor to exchange this data. We don't set those types of expectations. So again, those infrastructure rules included processing requirements for the mode. Is it a real-time transaction or the batch transaction? Response time, system availability, connectivity, acknowledgements, companion guides, all of that data and information of how to set up a version of a software to ensure that claims data can be keyed or input from an EHR and a practice management software or a PMS system through to the health plan. So the health plan receives a nice clean claim and they can adjudicate that as expeditiously as possible to issue payment, right? All important components of that data exchange. On the next slide, you'll see that some of the specifics that we have related to the infrastructure include the common connectivity method. CORE does require the data to be transmitted over the public internet using a SOAP or a MIME vehicle. That's an envelope basically for the 837. So you can submit this through a commonly used web-based API methodology mode to transmit that claim from your PMS system or your EHR to the health plan. And you can be supported again with any vendor in that process. We also have this 90% system availability, so systems have to be up and running to receive claims because providers are submitting claims at all hours of every day of the week. It's not just a 9 to 5 billing cycle process. So having those systems up and available to receive claims is really important for providers in the conduct of their own business. We do, as I mentioned, we don't just focus on HIPAA mandated transactions. We also have acknowledgement. So we require entities to implement, for example, the 999 transaction or the 277 CA, the claim acknowledgement transaction. These types of transactions support the conduct of the X12 837 transactions. It ensures for providers that nothing falls into a black hole, that they actually receive. I sent in 500 claims on Friday for the week. I know that my clearinghouse has received all 500 of those claims. None fell out of the basket as it made their way from my system to the clearinghouse system. And the clearinghouse has the ability to send those 500 transactions to the health plan and can inform the provider if any of them fall out of the basket between the clearinghouse and the health plan as well. Using those acknowledgements is really helpful to ensure the continuity of the revenue cycle from the provider submission to the health plan receipt and the health plan adjudication. It's really important for that revenue cycle to understand all of the tickets and tokens that are being passed along the way, that everyone gets the right balance all the way through. Part of this is also supported by our companion guide template. This is a way to ensure that if you as a health plan or as a vendor require a specific set of data or a specific methodology of receiving that data from your providers, that you designate what that looks like in a companion guide. And we've developed a template so all the companion guides look the same. So it makes it really easy for consumers or providers who are setting up their EHR or their PMS system to ensure that that data looks this way for a national plan like United or Humana, and looks like this for your MCO in a small county that's managing a Medicaid population. The needs are going to be quite different, or can be quite different. Again, there's uniformity and consistency because of the standard, but sometimes those health plans, those payers, those receivers of the 837 need something just a little bit different from one plan to the next plan to the next plan. Part of that could be because of the type of insurance product that that member has. They might be in a government plan, they might be in a commercial plan. So those variations and variances can be detailed in the companion guide. Makes it really helpful. With that, we can transition over into what we're working on currently. And this is our healthcare claims operating role overview for the data content. Again, all of what I just spoke about was for the infrastructure requirements. Now looking at some specific content that we've been working on over the last couple of years. On the next slide, you'll see that even though there are lots of consistencies because there is a standard, because X12 has published an 837 implementation guide for professional claims and institutional claims and dental claims, the consistency is really, really helpful. But providers do bill differently, and they come from different specialties. They come from different backgrounds. The requirements, as I mentioned, like in the companion guide examples, the requirements for a national plan to a state plan to a government-based insurance plan to what a particular commercial product might need, right? You might have a retiree benefit versus a C-suite benefits or benefits package versus a worker on the line, right? Someone who's, they have different products that they're consuming, that they've bought with their insurance company. And so that those inconsistencies cause problems, right? As we all know, it can really lead to differences in how that looks. We also know that there have been upticks over the last few years with a number of claims that are denied. the volume has increased. From 2016, it was 9%. The most recent report, it's nearly 12%. So 10% of the claims that providers submit are denied. That is a huge impact for providers. And again, a huge part of the provider abrasion is understanding the reason for these denials. And are any of them actually related to the content of the data on the 837 when they generate it? And the answer is yes, there can be problems with the data as it's coming in. So how can we identify those abrasion points, those bad data or inconsistent data, right? The provider bills this way for United and this way for Humana, and then all these ones from Humana make it through because they get denied, but they pay over here at Aetna. What's going on? Right, those types of questions that providers have. We've been conducting environmental scanning and doing research all through 2022 and half of 2023 really to look at those opportunity areas. And then we launched a subgroup in April of this year to look at those opportunity areas and see where data content might help relieve some of those pain points. So on the next slide, you'll see a couple of our examples that we have for what we have identified for data content areas to address through operating roles. One of these is related to telehealth and telemedicine. As you can imagine, lots of discussion around this particular topic with the onset of the pandemic and how the Medicare has issued guidance, how commercial plans have changed through that period, and then how they're changing again. So it causes inconsistent data coming from the providers because the providers have to do different things for perhaps a Medicare claim versus a commercial claim versus a state Medicaid claim. So how do you use a place of service code? How do you use specific modifiers? If everyone does it differently and it's inconsistent across the board for every plan, that makes it really challenging for the provider. They have to know with a Post-it note probably on their screen that I'll have to do it this way for this plan, and this way for this plan, and this way for this particular employer group at this commercial plan, a different way for a different employer group at the same commercial plan. I can only know the difference if I look at the group ID number, right? That can be really problematic for providers. So we're looking at a way to ensure a little more uniformity and consistency when it comes to place of service and the modifier combinations and what that might mean for providers and for health plans. If we can get more consistency in that approach, it really helps the industry overall. Another important component, I mentioned the 277CA, the claims acknowledgement. We do have this requirement currently in our infrastructure rule. What we've done now is to layer on data content within the 277CA, and that is related to the claim status category codes and the claim status codes. Using these codes in combination really allows the provider to understand perhaps there is a data issue or an error on that claim, and because that claim may be rejected either by the clearinghouse or by the health plan. So to better understand the reason for those rejections at the front door of either of those, either of those stakeholders, the clearinghouse or the health plan, allows the provider to more systematically and automatically and more uniformly address the data problem on that initial claim, make that correction and resubmit it in a much more timely fashion. If they're not getting a 277CA, they might not know that that claim is going to be rejected or denied until days or weeks later, depending upon the revenue cycle and the adjudication cycle at the health plan. If a provider has to wait 30 or 40 days before they receive that 835, that's a whole month of AR that's been sitting there. They now have to go back and correct those claims, find the data, correct the data. So it makes it much more burdensome if it's a manual process at the end of the process, at the denial level, versus in the very front with the 277CA. The last topic that we're addressing is also COB. I know that Lynn mentioned that there are specific transactions for COB, and that is exactly right. And those are used extensively throughout the industry, as well as using the regular base 837 to support COB claims. So how can we ensure that we know that there's inconsistent requirements across health plans on what they want to see in an 837 COB transaction, or what data that provider must submit for that secondary consideration? So how can we become more uniform with that data across the industry so providers don't have to have that variability on their side when it comes to understanding what those needs are, right? If it's uniform for Doesn't matter if you're Medicare, Medicaid, or commercial to commercial crossover. How do we understand that data, and what does that mean? And what can providers do to ensure the data is consistent and uniform? They don't get dinged by denials or rejections because they don't have the right data, or it's incorrect by the time it gets through the adjudication system and gets a result in a denial. So those are the topics that we're addressing in our data content. And with that, I know we got about 10 minutes left. We have a few minutes for questions. So I'll hand the call over to Jackie to help moderate any questions we might have from the audience, as well as from our pre-registration polling.
Thanks, Bob. So just a reminder, if you do have a question, please feel free to submit it now in the right-hand corner of your screen. There's a little menu item that says questions. So we'll be monitoring those as they come in, but we haven't received any throughout the presentation. So that being said, we do have a couple of registrant questions. I'm going to go ahead and ask the first one. This one is for you, Bob. So the question is, we understand that the acknowledgement transactions are not required under HIPAA. Why does CORE require their use? For example, the 999 and 277 CA.
Oh yeah, that's a great question. The one that goes all the way back to 1996 with the original HIPAA legislation and the regulations that followed that in the early 2000s. The law and the regulations didn't call for the acknowledgements, the use of the TA1, the 999, the 277 CA, or lots of other standards that X12 develops, really. There were lots of potential things to include, but they weren't. And what the industry has, they've come to CORE, the CORE participants have come to us, and they have requested that the industry really needs these types of acknowledgements to ensure really the safety and the flow of the data. There's no black boxes where claims fall into. So it's we have required the use of the 999 and 277 CA for years now. And if you're going to get certified through CORE certification for your claims product, if you're a vendor, an application software vendor, or if you're a health plan, you'll have to show and demonstrate that you conduct and use the 999 or the 277 CA. So it is a requirement for CORE because it's really the right thing to do when it comes to conducting electronic transactions for both EDI or a web service. You have to know when someone sends data, when you receive it, let them know that you received it, and then you received all 500 claims in that package, and none fell out along the way. So you really have that consistency of data. It's really important for us and important for the CORE participants that is something they require.
Great, thanks, Bob. And I think a quick follow-up question, we have someone asking if these requirements are voluntary or mandatory.
Oh, great question as well. The CAQH CORE requirements for claims for our infrastructure, as well as our soon to be published data content requirements, those are voluntary for now. We will go through the process as we normally do, have our CORE board sign a letter to NCVHS. NCVHS will make a recommendation to HHS. There's a process that our requirements can be made to become mandatory through regulation. But everything that we do is initially voluntary because our participants feel like it is the best approach to meet those business challenges today.
Perfect, thanks, Bob. I have another registration question. This one is for the X12 team. How does X12 respond to changing industry needs? For example, do data needs evolve as health plans develop new insurance products for consumers for things like value-based payments, CPAs, et cetera?
There is a process within X12 called the MR process. Somebody can submit a maintenance request and it will go through a process to get changes made to the standard or the implementation guide. And then X12 publishes the work products annually. In the claims, if there is a legislative requirement, there is a segment that can be used. It's the K3 segment, but that would need to be approved by the X12 in order to use that segment. So there is information in the implementation guides on how to request permission to use that segment.
Yeah, I
Jamie
think,
or
and this,
Stanley?
yeah, this is important, is that anyone, whether you're an X12 member or not, can request a change. And that request goes through the necessary channels. And if we're talking about updates to the claim, it would come to the work group that Lynn and Jamie and I chair. And then the process allows for updating of the guide and publication sometime later. So we consider each and every one of the suggested changes, and of course, X12 members at our meetings and such also might identify needs to update the transactions, and we submit MRs to make those things happen.
Great. Thank you, Lynn. Thank you, Stanley. I haven't seen any more questions come through, so I think we're going to go ahead and transition to the next slide. I'm going to pass things back to Bob just to go through a brief call to action and talk a bit about our upcoming core education events.
Great, yeah, definitely. Definitely our call to action is, if you're not participating with CORE, please become a participant. And I'll echo what Jamie mentioned as well earlier. If you're not participating with X12, please participate with X12. Again, the industry knowledge probably represented on this call this afternoon represents probably thousands of years of experience in dealing with claims. And we can really use that experience, both organizations, X12 as well as CORE. We can use that knowledge that you have, right? Getting all of those variances and nuances together is something that we could use. Also, if you have not considered CORE certification and you have a claims process or product on the market, or you're adjudicating claims on the daily, consider getting that certified, because it really can help demonstrate that you're exchanging the data, receiving the data exactly as the standard as well as the industry advocates for. Again, also be an advocate. If you're working, help us with ROIs, help us understand what the cost benefit analysis might be for your organization as you make changes to claims. All that can be really helpful as we develop potential new standards or modify the standards for the claim, as well as modifying and updating new rules for the claims data content for operating rules. On the next slide, we have a lot of stuff going on to help keep the industry engaged. There's a number of webinars. I mentioned that we have worked closely with X12 over the last couple of years. We're going to continue with our X12 education series on the 270, 271. It's going to be more of an advanced versus this today was a little more of an introductory. We'll continue to build on this one in future webinars. We have some interoperability for value-based care. We have another town hall coming up, the last one for the year. We have an administrative and clinical interoperability also right after Thanksgiving. And some, again, we're actually going to do an introductory education webinar with X12 again on the 275 transaction. You'll see us around the country as well. We'll be in Indianapolis for HBMA, as well as attending the WEDI National Conference in DC and hosting our own conference next week in Washington, DC. So come check us out. Our website has everything you might need with easy ways to access and register for these events. So thank you and have a good afternoon.
Great. Thanks, Bob. Thanks, everyone, for joining us. Our email's on the screen if you have any questions, and we look forward to seeing you at our next webinar. Have a good afternoon.